Good day everybody, and welcome to this first lecture of General Medicine for dental students. Our presentation today will discuss the disorders of the cardiovascular system. At the beginning, let's look on these pictures, and then I'm going to tell you the implications from watching them. So dentistry is, and watch the pictures. This is from the patient side, how he looks at the dental clinic and dentists, how this may be a stress for him. These different pictures. Little funny, but pain and anxiety, this is a fact, increases the cardiac load and increase the risk of precipitating cardiovascular complications. So we have to bear this in mind while dealing with any patient, and in particular the cardiovascular patients. We have to put the patient in an atmosphere where there is no pain whatsoever and no stress or anxiety. Also, we have posts from the Facebook to show you how the patients consider that dental treatment and dentists are stress. Sometimes, or some patients consider that there's a link between the dental chair and the electric chair used for execution in the United States. And this is a fact. The electric chair was invented by dentists. This is true, actually. So what to do? Like I said, no pain, no stress. We have to take a very good history. This history can elicit the presence of cardiovascular disease, and examination is not like a physician do, but you can notice by your eyes, just by inspection, some abnormalities like pallor, like cyanosis. You can notice that the patient does not breathe comfortably, that there is certain signs like finger clubbing or ankle edema. Also, you have to ask about drugs or the medicine that the patient may be taking, which can interfere with whatever drugs you're going to prescribe, as well as any surgical operation. And we have in the cardiovascular field, we have the coronary artery bypass graft, we have valve replacement, or even in the West, we have cardiac transplantation. In order to show you that the cardiovascular diseases is very common in our society, let's have a look on the risk factors for cardiovascular disease: smoking, excess alcohol, diabetes mellitus. Of course, excess alcohol is not in our society, thanks God, but this is a problem in the West. Diabetes, hypercholesterolemia, family history of cardiovascular disease, sedentary lifestyle, and obesity. Relevant points to take into consideration while asking the history is these 16 points: chest pain, angina, myocardial infarction, hypertension, any medications like aspirin or warfarin, loss of consciousness or syncopal attacks, shortage of breath or exercise tolerance, rheumatic fever, infective endocarditis, cardiac rate or rhythm abnormalities, cardiomyopathy, coronary artery bypass graft, valve replacements, congenital disorders, cardiac transplants, and finally venous and lymphatic disorders. We will start by discussing ischemic heart disease. Ischemic heart disease is a disease where there is reduced blood supply to the heart. It's caused by an atherosclerotic plaque formed on the inner walls of the coronary arteries, so narrowing them. classification of ischemic heart disease, and you should notice that in these three categories in the classification, or these three disease entities, the symptoms are the same. All of them give angina. What is angina? Angina is cardiac chest pain. First entity is stable angina pectoris. Second is unstable angina pectoris. And third is myocardial infarction. What are the characters of cardiac chest pain, which is present in the three entities, in the stable angina pectoris, unstable angina pectoris, and myocardial infarction? There is a central retrosternal crushing chest pain precipitated by exertion and improves by stopping exercise. The pain is central, retrosternal, very severe crushing heaviness on the chest. It is precipitated by exercise, exertion, and is relieved by rest or stopping the exercise. This pain may radiate to the neck, to the mandible, to the left shoulder and the left arm, or to the back, and it may be felt only in one of these sites without the chest pain. In unstable angina pectoris, there is a sudden change in the character of the pain in a patient who has had stable angina pectoris for many years, but suddenly this pain gets worse. He gets an attack of pain which is much severer than the previous attacks, or the duration of the pain became a little bit longer, or this pain may come to him at rest, not with exercise. Here the problem is that there is very high risk of developing myocardial infarction, and this patient is required to be admitted to the intensive care unit and to be treated as if he has myocardial infarction. What is the management? And here by the management I mean, if this patient with unstable angina pectoris comes to you, or you were invited to see this patient while he is in the intensive care unit, what are you going to do with him at this state? Elective dental treatment is totally contraindicated. You cannot treat this patient while he is in the intensive care, or while he is having the unstable angina pectoris. But what if he comes to you in emergency, or you were called to see this patient in emergency? In emergency conditions, also you're going to treat the cause of emergency. For example, if there is pain, you can give analgesic. If there is infection, you can give an antibiotic, and that's it. And if the condition requires that you do any procedure, you avoid using or putting or adding adrenaline to the local anesthetic. For angina pectoris, what is the management? And the management also, I mean from the dentist. What's he going to do with a patient having angina? Number one, sedation is very useful for stress reduction. Analgesia should be very effective, not to make the patient feel any pain, and this can increase the cardiac load on the heart. The appointments are better to be shorter than the regular patients. Oxygen is very useful, and it can prevent the anginal attacks, because the problem in angina or in ischemic heart disease in general, that the amount of oxygen reaching the myocardium is less than it should be. And number 5, glyceryl trinitrate sublingual or spray. The spray preparation is preferred than the sublingual preparation because it has got a longer shelf life. Myocardial infarction, signs and symptoms of myocardial infarction are like angina, the typical cardiac chest pain, but here the pain is much more severe and of longer duration. We can find the patient exceeding the usual duration of stable angina pectoris, which is around 25 minutes, We can find a patient having the cardiac chest pain for more than 1 hour, 2 hours, 3 hours, and this pain is not relieved by glyceryl trinitrate spray or sublingual preparations. Now, what is the management if a patient with myocardial infarction comes to the dental clinic? First, you have to postpone the dental treatment for at least 3 months from the occurrence of the attack of myocardial infarction, ideally 1 year after the myocardial infarction, but let's say for at least 3 months. If an emergency condition comes in the first 3 months, I have to consult the cardiologist treating the patient. Local analgesia must be effective. General anesthesia, if it's needed for a patient with previous myocardial infarction, should be performed in a hospital and not in the outpatient clinic. And always, 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 sedation should be considered. Thank you very much.